and it was dead straight. You had to get a little, like a carpenter uses to see. I said, this doesn't look good. It's not the greatest line, but I was proud of it because it did. It went down either a quarter of a point or an eighth of a point, tiny. And now think of what we're doing. We're bringing medicine down by many times. Nobody's ever seen. And there are two ways of calculating. You could say 1,000%, 2,000, or you could say 90% or 80%. The Democrats want you to say 90 or 80, but there are two ways of calculating it. You understand that, Dan? And we'll take either way. It doesn't matter. But we'll be paying a tiny fraction. So that's going to go into our plan. And what Oz said is very important. It's very important that whoever is in this office is, strong and intelligent. And if they're not, they could, it could be ended. But what we want to do is we want to have it codified, so it's very hard to change. And that's all part of the process. I think it's the greatest revolution because it's financial is, a big part of the drugs. And all of the doctors sitting there know exactly what I'm talking about. They have their patients in Europe, and they're saying, I can't believe it. I'm buying the same thing for, 15% of what I pay in New York or in Chicago. And they're all nodding their heads. That's right. That's not going to happen anymore. We pay now, just to end it, the lowest price in the world, whatever that is, that's what the United States of America will be paying. Isn't that an amazing, long story? I was going to say long, boring. It's not boring. To me, it's long and exciting. It's the biggest thing to happen to healthcare. I don't think there's anything we can do. We can do all of our different methods, but there's nothing we can do that can ever top what we do. And the press should treat it fairly instead of not writing about it, because they don't write about it because it's me. Primarily because it's me, but also because it's Republican. And they don't write about it, and they should be ashamed. But fortunately, the public understands it, and that's why we won the election in a landslide. So it's a great thing. Instead of Americans paying the highest drug prices anywhere in the world by far, by 10 times sometimes, will now pay the lowest cost paid by the lowest nation. So the lowest nation, whatever that is, I hope they negotiate a great deal. I hope somebody out there of all those nations is going to be a better negotiator than everybody else. And whatever they get, we get, Mike. Is that pretty good? Look at Mike. Even Laura, first time I've ever seen him smile. And next, our plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending the money directly to the people. So instead of, and this started, and I'm not really a healthcare maven, but I was always a good businessman. It started, I'm reading the paper, and I see the money that the insurance companies were making from us on Obamacare, and they're up by 1,000%, I think one was up 1,723%, 1,700%. And it's because of the massive amount of money that's sent to them by the United States government. And I said, why don't we just send it directly to the people instead? And I made that statement. It was a common sense statement. I didn't check with anybody. I didn't even call Oz or anybody. It just made sense. I made a statement, and it went viral. Can you believe it? It was so popular. In other words, we cut out the insurance companies. They're making a fortune. And, they're good people. They're business people. I don't blame them. But we cut them out. We pay the money directly to the people. The people love it. I said it, I said it as a non-professional in that business. And I made the statement like all of a sudden it's like the biggest story, that one, the biggest story. And I get a call from Caroline, who's around here someplace. She said, sir, we're getting inundated. Margot called me too. Margot, you called me too. Margot, everyone knows Margot. She's been here from the beginning, right from the beginning. But she said, sir, both of them. They said, sir, we're being inundated by what? You made a statement about health care being paid directly to the people into health savings accounts or whatever you want, health care accounts. And I said, I did. What's the story? He said, it's crazy. It's blown up. People loved it. And so that's where we started. So Obamacare was designed to make insurance companies rich. It really was. I mean, maybe not knowingly at the time by Obama, because he didn't know much about this stuff. That was designed by other people in Congress that are total pros that are bought off by the insurance companies. And the problem we'll have with this is we'll get no Democrat votes, even though it should be very bad for them if they don't. But maybe you'll get some. You'll call some of your friends, fellas, and Bob, you'll call some of your friends over on the other side. I don't know how they can reject it. It's just so popular. It's so compelling. So Obamacare was designed to make insurance companies rich with taxpayer subsidies, and I want that extra money straight to the health savings accounts for you. And you can choose your own health care. You go out and negotiate your own health care. It makes people entrepreneurs, mini entrepreneurs. They'll pick the health care that's best for them because it's so different. A young person, they need health care for different reasons, and an old person doesn't need certain things that a young person needs, and vice versa. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen. We're getting rid of the middlemen. How long have you heard doctors, all these doctors over there, look so smart. They're all brilliant people. I assume you're brilliant, otherwise you wouldn't be here, right? I assume we have the best. Do we have the best of the doctors? I would imagine, right? Hey, how cool is the White House, okay? They're always in operating rooms. I wouldn't want to be in an I don't like operating rooms, but they do. But how cool is the White House, right? The coolest place on earth. And this is where it all begins. This is where we came up with a little concept about a place called Venezuela. How did that work out? And this is going to be the same thing in terms of its precision. Its importance is so big. It's going to work just like that. Venezuela was so amazing. But I equate that to other things because we can do other things like that. It doesn't always have to be a Minnesota where everything is corrupt, where they have health care centers that nobody shows up and somebody's making millions of dollars, where they have daycare centers where there are no kids. It's a scam. It's a big scam. It's like a horrible thing. We have a country that was great. We have a country that's now great again. It's really come a long way. Make America Great Again is almost going to be obsolete because our country is very close to, you know, we were going to keep America great. We may have to switch to keep America great. But I don't know. There's something about MAGA. We should never change it. Susie said, don't change. We like MAGA. Everybody likes MAGA. So we want to make this precision, just like a Venezuela, just like the attack on the Iran nuclear weapons, which wiped that out, just like all of the other things we do, they're precision. We want to make it the opposite of Minnesota, California, and all these places that are so badly run. So to further reduce insurance premiums, my plan ends the giant kickbacks to those insurance brokers and corporate middlemen that you've been hearing about for so long. It also funds the so-called cost-sharing reduction program to bring down the cost of the most common plans on the exchanges by more than 15%. And next, the great health care plan mandates unprecedented accountability and transparency from insurance companies and all health care providers. We want transparency. You're not allowed to ask a doctor how much is it going to cost. You're going to have your heart ripped out, and you're not allowed to negotiate. This is a giant scam. It's, in certain ways, look, nothing can compare to most favored nations. But when you give yourself the right to negotiate, you're not allowed to even ask how much it costs. You're supposed to go into a hospital and get operated on. Then they send you a bill and you have to file for bankruptcy. Not going to let that happen. So we're going to have insurance companies and healthcare providers going to have great, and hospitals, great transparency. The word transparency is a very important word. So they can't get away with ripping you off any longer. It requires insurance companies to make it easy for you to compare plans. You've got to be able to compare plans. You can't do that now. You're not allowed to do that. It's not even believable. I tell you what, I used to sit before I was a politician home, and I used to say, how is that possible? Things happen that, I guess it's just the forces of nature, the forces of power, and you end up with very, very badly treated people, and they won't stand for it. But these forces are going to release an earthquake of reduced price health care. You're going to have massively reduced costs. This is no longer we're going to cut it by the famous 1/8 of a point. You're going to have massively reduced health care, and it's going to be massively better. You're going to have great health care at a much lower price, which is the two things. We want great health care and we want low price. You're going to have great health care at low price. Now you have terrible health care at a high price. You have horrible, horrible Obamacare health care. Like everything else he did, it was crap. It was a horrible plan. It was from day one, and it should have never been approved. It was a very sad night that night when there was a thumb raised. Most importantly, we'll require any hospital or insurer who accepts Medicare and Medicaid to prominently post all prices. You're going to post your prices at their place of business, something they don't have to do, something they're not even allowed to do. We'll have the maximum price transparency, and the cost will come down just by that, not even talking about favored nations. The price will come down. So just in conclusion, I'm calling on Congress to pass this framework into law so that we can get immediate relief to the American people, including rural America, and I hope to get Democrat votes. They know, they saw it. I know a lot of Democrats. And they say that plan is unbelievable. Are you going to vote? Well, I'm going to try. They have tremendous pressure on them. Vote no. Vote no. We have a couple of Republicans. Thomas Massey always votes no. He's like, something wrong with the guy. If you have any clinical psychiatrists in there, maybe go check out his mind. But he always votes no. He's a very bad person. He's a very bad Republican, bad American when you always vote no. Just vote no. Do you approve? No. You know, there's not a thing you can